Now, rising cases of maternal and newborn deaths are driving calls for sweeping changes in how Kenya handles maternal health, demanding stronger accountability, national county coordination, data-driven county responses and leadership accountability to close deadly gaps in care. Now, alongside policy reform, an unlikely force is gaining ground. TikTok, now repurposed for maternal health education, as young doctors like Dr. Arori Patricia use this platform to educate the masses. Here is Anne Musingo with the details.
Known for causing this secondary infertility, and many women have struggled with this.
Famous for viral dance moves, TikTok is now doubling as a crash course in maternal health, spearheaded by Dr. Arori Patricia, who hosts sharp, engaging lessons born from Zoom sessions and audience feedback, exposing glaring knowledge gaps in turning scroll time into practical health education for women.
I went to TikTok like a year ago. I started creating awareness about some of the health issues in women, adolescent girls, teenage pregnancy, some of the women about family planning and how some women get pregnant and they don't go to clinic or they don't even know that they are pregnant. So after starting this project, that's when I decided that I can do a research based on my TikTok, because through TikTok I was doing live sessions, I was looking at my comment section, and from this I was able to see some of the gaps in women health.
This as pressure is mounting for a tighter partnership between national and county government as concerns grow over preventable deaths linked to childbirth. Leaders argue that stronger coordination, shared responsibility and aligned action across both levels of government are critical to reverse maternal and newborn deaths and saving lives. Speaking on the sidelines of the maternal and prenatal deaths during the 50th celebration of Kenya Obstetrical Gynecological Society of Kenya in Mombasa, leaders from both levels of government called for continuous nationwide data sharing, stressing that collective learning is key to reduce preventable deaths among mothers and newborns.
Most deaths can be prevented through practical changes in readiness and care, and we must protect the culture that makes MPDSR work, and that is no name, no blame, and no shame. This is about learning and fixing systems and not punishment.
There is a growing demand for county-by-county action to pinpoint exactly what each region is facing. Advocates argue that targeted responses, not broad generalization, are essential to address specific shortfalls, allocate resources effectively, and deliver solutions that reflect the real need of communities on the ground.
Why don't we share the learnings? And that is what MPDSR is all about. This is what the Intercounty MPDSR is all about. We want to learn from each other so that the mistake made in Kisumu should not be done in Mombasa. And so we are facilitating rapid sharing and scaling of best practices across countries. For example, Nyeri's daily report and Kiambu's preeclampsia SOPs.
The active involvement of leaders in addressing maternal and prenatal death has been strongly endorsed, seen as an essential in elevating the issue of national priority, sharpening focus, and ensuring sustained attention is directed towards saving the lives of mothers and newborns. Anne Musingo, KTN.
Our story by Anne Musingo takes us to a fast break. We'll be back with more, including the incorporating of artificial intelligence in early learning in the country. Do stay with us.